In today's busy world, we face many daily activities that could easily put stress and strain on our necks. Stress and strain on our upper necks can trigger a type of dizziness called cervicogenic dizziness. In this video, we're going to look at some of the best tests for ruling in cervicogenic dizziness. Well, welcome back to another episode of Physio Tips with Marrow. I'm your host, Marrow Burnett. For those of you that don't know me, I'm a board-certified orthopedic specialist in physical therapy and the owner of Australian Physiotherapy Specialist Physical Therapy Center located in Jacksonville, Florida. For today's video, we're going to cover ruling in cervicogenic dizziness. We're going to kind of break it into three categories. The first category is going to be subjective exam. Things that verbally might tip off that you may have cervicogenic dizziness. The second category we're going to get into are ruling in neck pathology or cervical spine pathology. We're going to show you a few simple tests that you can do at home to rule in if you're having true cervical pathology. And lastly, we're going to cover special tests that are useful for ruling in cervicogenic dizziness. First, let's start with defining cervicogenic dizziness in case maybe this is a diagnosis that's new to you. Cervicogenic dizziness is a dizziness that can be triggered from the upper cervical spine. You have 7 neck vertebrae. The top 2 or 3 vertebrae, C1, 2, and 3, if that area of the spine is tight, sore, inflamed, one of the symptoms from upper cervical pain is dizziness. There's been lots of research on this over the years. In 1955, 2 doctors named Ryan and Cope did an experiment where they injected into the upper neck to disturb the upper neck and test what would happen. What happened was it triggered dizziness and disequilibrium to the side that they injected. So cervicogenic dizziness, unfortunately, is a very common dizziness that's out there. Doesn't get talked about as much as some of the other forms of dizziness, but it's very prevalent. One of the reasons many experts feel that it's so prevalent today is the environmental factors that our necks face every day, right? We have computers, we have tablets, we have phones. Everything that's gone into the new digital age puts a lot of stress and strain on our neck. So that leads us to our first group of tests, which is subjective exam. Let's take a look at subjective exam. Okay, for ruling in cervicogenic dizziness, let's start with the subjective exam features that we might find in someone that has cervicogenic dizziness. The first thing that I like to talk about is loss of hearing. If you've suddenly had dizziness and also had a loss of hearing that correlated with that same time as your onset, this may be something other than cervicogenic dizziness. For cervicogenic dizziness, usually this is a dizziness that comes on that does not have an obvious ear infection or hearing loss or some other type of brain injury when you get your dizziness. Cervicogenic dizziness often accompanies pain in the neck, pain with awkward postures, maybe looking down or looking up too much. This can easily trigger pain in the neck. That can trigger cervicogenic dizziness. Those other subjective exam features that we could look at would be pain in the upper neck commonly can cause headaches. So if you notice you're suffering 2, 3, 4 headaches a week and it started pretty around the same time that you started having dizziness, that is an important feature right there because that would be kind of more classical with cervicogenic dizziness. Now, some of my patients, they don't have all of them have headaches and dizziness. Some might have headaches, some might have dizziness, some might have nausea. The upper neck can even trigger a TMJ type pain that can radiate down. But if you do notice you have several of those boxes checked, yes, I do get headaches sometimes, yes, I do get dizziness, yes, I do have obvious neck pain, those are the classic subjective features of cervicogenic dizziness. Another feature that we could look at is true vertigo usually lasts 30 seconds to a minute and it starts to subside with a severe spinning sensation. For cervicogenic dizziness, you might feel more of I just feel off, I feel a little off balanced. If I get up suddenly, I feel a little bit dizzy or off balanced. But these symptoms could come off and on all day long. It's not just a 30-second episode. So this can persist for minutes to hours to days to months. It can be very chronic, can be pretty debilitating. So those are some subjective features that we might expect with cervicogenic dizziness. Now what we're going to look at are some physical tests that we can do for ruling in cervicogenic dizziness by looking to see if you have obvious neck pathology. Let's look at that next. For ruling in cervicogenic dizziness by doing specific tests for the neck, this can be another great part of our exam. So let's look at a few obvious things that we can do to rule in neck pathology. The reason this is relevant is a lot of times you might think, I don't know if I have a neck issue. I've had problems off and on with my neck. I don't know how relevant this is. And you might even think, I don't have a neck problem. Many of my patients will say, no, I have a dizzy problem, not a neck problem. But when we get into the testing of their neck, we start to find out, indeed, they do have some issues with their cervical spine. So let's start with something easy. We're going to do a range of motion assessment, okay? You could do this along with the video if you'd like. But what we're going to do, we're going to start with range of motion to the left, as far as you can comfortably, and then back to the center. Did that make you dizzy? Did that cause obvious pain or tightness? These are important data points. Now let's look to the right, as far as you can comfortably, and then back to the center. Did it make you dizzy? Did it cause pain? Did it cause tightness? Was right different than left? That's another important feature. Now we're going to look at flexion, bringing the head all the way down. Same questioning. Did it make you tight? Did it make you dizzy? And then we're going to look at going up. Now, a couple common range of motion deficits that lead to cervicogenic dizziness would be rotation. My patients frequently tell me that's a position that can make them dizzy, and also the looking up. Lastly, let's look at side to side. You bring your ear to your shoulder, and then you bring your ear to your other shoulder. If your neck's doing pretty well, then you might find that none of this is too bothersome, but if it does cause some tightness or some discomfort or dizziness, that can be a good piece of information as we're getting into this exam. So there's our physical exam. We've done our subjective. Now what we're going to do, let's look at a strength test as well. The strength test can be very, very good clues on if you really do have cervical pathology. So let's go over to one of these tables and let's look at a strength test. Welcome back, everyone. Okay, I'm going to attempt to do this with a lapel microphone, but if the audio sounds bad, I'll just go in and put better audio. But we're going to attempt it like this. So for this test, what we're going to do, I'm going to nod my chin in a little bit to make a crease at my jawline. Once I do that, I'm going to lift my head an inch or two off the pillow, and then we're going to look to see, can I hold it for 20 or 30 seconds? 30 seconds would be a good normal score. Or is it shaky? Is it hard to hold? Does my chin want to come up and lose that crease? Or does it cause dizziness? It causes neck pain, headache, dizziness, or you just notice it's really shaky immediately and you have to put it back down. That would be a classic sign that you've lost strength in the muscles in the front of your neck. So that is a great test. Sometimes with the range of motion test, you might notice I've got pretty good range of motion. I don't feel too much pain touching the upper neck, but my strength is pretty bad. So that's a great test to help rule in cervicogenic dizziness. Okay, for our final test for ruling in cervical pathology, we're going to look at a simple palpation assessment. You can do this to yourself. We're going to take maybe my first or second finger. I'm going to place it at the base of my head, right below my skull, just offset to my spine. So right off my skull, I'm going to do a little bit of gentle palpation where I press into the upper neck. We're looking to see, does it cause headaches? Does it cause neck pain? Is it tender? Does it trigger dizziness? Now what we're going to do is go about another finger's width below that spot, and that's going to put us pretty close to probably the C2 vertebra, just offset from the center of the spine. I'll show you from a side view as well. And we can move it down the spine all the way down into the lower neck, but what we're really interested in is these top 2 or 3 vertebrae in the upper neck. So now we do the same thing to the left side. 2 or 3 little gentle pulses. Does it uncomfortable? Is it tender? Does it make you feel dizzy? If it does, then obviously don't keep doing the test, right? You got a positive. But that's a simple test that you can do to see if you have signs of upper neck pathology. So now we've got our subjective exam, we've got our range of motion assessment, we've got a great strength assessment, and now we've got a great palpation assessment. So that'll start the process of ruling in cervicogenic dizziness. Well, thanks for watching today's video on subjective and physical tests of cervical spine pathology. Stay tuned. Next week, we're going to put out another video where we're going to look at some special tests for cervicogenic dizziness to help rule that in as well. And also at the end of this video, we're going to put up a video that shows some exercises that you could do if you feel like you do have cervicogenic dizziness to start maybe giving yourself some relief. In Physio Tips with Marrow, we have several videos of different techniques that you can do, from manual therapy techniques to exercises. So don't forget to check out the rest of our videos as well. So we hope you enjoyed it. Remember to subscribe to the channel to receive more videos like this in the future. And we appreciate you guys watching, and we'll see you next time on Physio Tips with Marrow.